On your routine CT scans, you would often be confronted with this dilemma where there are multiple radiating bands at approximately the level of the mid-thorax, where it's very difficult to determine what they're originating from. In a normal CT thorax, there are usually two bands extending from the lung apex, and these are the oblique fissures. In the right lung, there's an additional fissure called the horizontal fissure, which normally extends in the anterior-posterior direction. Despite being horizontal, the fissure is not entirely a straight line, and when viewed on an axial image, you can often have the confusion of having multiple bands like this. To appreciate this, it's best to look at the sagittal and appreciate that the contour of this is rather like a dome. So we're going to change this to a sagittal view, and here we are. This is the usual situation in most people. Mind you that any sort of surgery or even some normal variation can alter its course. In the majority of individuals, the middle portion of the horizontal fissure is at a higher point, and I'm just going to make it clearer for you. And now the lung markings are crude, but you can see the fissure very well, and the apex is at the mid portion. Going back to the axial, this is why it starts like a unusual circle on an axial view, and it plays out into two separate bands, which is the anterior portion of the horizontal fissure and the posterior portion of the horizontal fissure. So this is the way you appreciate the horizontal fissure on an axial scan. And suppose you have a pathology occurring in this position, you can be quite confident that it is in the middle lobe, and this portion is in the right upper lobe.